Welcome back to the Smile Mentor and welcome back, clinicians. I feel it a privilege to you guys today to talk to you about the patient and building that bridge between you and the patient, on giving you a mind's eye insight and a heart's eye inside the patient. I don't want to come at you as a clinician. You're a better clinician than I am. I don't want to come at you even sometimes from a business perspective. Although 25 years, pretty successful entrepreneur, got some business acumen. That's how our clients benefit from us. I really want to come talking from the heart first when it comes to why are you doing this and are you ready to do it? This has been my biggest challenge with those in the industry. I know it's lucrative. I know this is one that a lot of clinicians aim for, to be an all-on expert, right? That's why we trademarked that term, all-on expert. What does it take to be an all-on expert? A lot more than just your DDS. And it definitely takes additional training, I believe, by experts with reputable reputations, not some weekend course that some guy rents a bunch of cars and tickles your fancy and gives you some high-level course and you guys pay 40 grand for that. No, I'm talking by high-level clinicians that you have continued to go on and get your education through hands-on, through clinical training, through mentoring, being mentored by somebody who has been down this road. So, okay, that's what it takes from a clinical side. What does it take from a personal side? I believe you gotta have a heart. Guys, if you don't, fake it. You understand, like, who's the patient? I'm not talking to the orthodontists out there. I'm not talking to the pediatric dentists. I'm talking to those that specialize in implants and all on X. That's it. Your patient is a different kind of patient. They don't want to be told how they screwed up. If you want to use the tactic when it comes to shame and kind of making them feel embarrassed and telling them all the problems and then acting like you have a cape to come in, guys, please don't do that. Please don't do that. That is birthed out of insecurity. The secure guys, the confident, the real experts that I have gotten to know on a friend level from across this nation, I've seen them sit with that patient. You know what they're not doing? Oh, I got another appointment. Wait, okay. Yeah, could you hurry? No. Invest the time in this patient. They know that whether it be DNA, poor choices in lifestyle like drug use or poor hygiene, they know that they need this procedure. So how are you going to engage them if you don't know the heart of the patient? They wrestle with fear. They don't want to be seen. Shame. You guys know this. And you don't have to deploy that in your marketing. You do not have to deploy that in your consultations. Embarrassment. Think about it. You're going in, the patient is going into a room. They know not very much. More after this, they will, but they don't know very much about what this all is. They're scared of losing their teeth. They know they got problems. They're denture phobic. And I don't blame them. My mom had one for 20 years and I got to see that pain. And there's a time for it. Not everybody can afford this, which brings me back to your responsibility. You guys are getting paid well to do this procedure. Take the time for the patient. Get to know them. Do not use shame, embarrassment, any of that when it comes to your consultations. By you sitting in there with them and you face them, don't send in a 21-year-old, which you can hear from Laura Thompson. This happened to her at one of the big big name brand outfits. Don't send some 21-year-old in to point at a screen and teach her about implants. Take the time. How much is each patient worth to you? I know all the numbers, guys. I know what your margins are. I know how when you go from one of these cases to 15 to 20 of these cases a month, which we've done for our clinicians, I know what that does to the balance sheet. Okay, that's fine. Look, guys, if you really have invested all the time, energy, and effort and money that it takes to really become a all-on expert, okay, charge it. I get it. But that's not a $200-$300 filling, or now $500-$600 filling, or a $2,000 crown. You're talking about $25,000 to $30,000 an arch. That's a big case. So can I please encourage you guys? This patient needs compassion. This patient needs to know you care. This is a relationship, not a filling that you take and you see them, and maybe you'll see them in a couple years when they have another filling or a cleaning, stop in to hygiene. This is a relationship. Think about how many appointments, if you watch this or I mean, you're with them for 9 months, unless you're like some of the outfits out there that say done in 24 hours. But the good ones are building a relationship with these patients. Look, they come in nervous, they come in scared, and after they come through the Smile Mentor, they will come in prepared. But man, show them you care. Okay, guys. I don't know how much of this is probably therapeutic for me. I don't mean to beat up on you guys. I really do want to, any emotion you see on that, I just seen it abused so much in this industry. And my heart is that you will come out of this and that patient will change in your eyes. You don't see dollar signs. You see a life, a changed life. I know how powerful this is, and it's in your hands. Treat it with care. Appreciate you guys. Hopefully you've subscribed. Maybe you might not want to after this, but I do promise you we have more good stuff coming. So appreciate you.